Hi everyone, this is Christina Riggins, QI Coordinator Trainer for the Clinic Division. In this series of videos, I am going to review the standard work processes for the front desk. In this particular one, we are going to talk about new patient registration. As you can see on my screen, we have our standard worksheet up, and we have our process, which is the new patient registration. The owner is going to be the manager. We have a revision number here. We have the trigger, which would be a patient calling, and the cycle time is about 12 minutes. That does not include the time that the patient takes to talk about their issues or, their whole life story. It's just the 12 minutes that it takes to create the patient chart and collect all the data that we're asking you to collect. We do have a sequence number, so like steps. Step 1, 2, 3, 4, 5, the sequence in which it should go. Our major process steps, we have the responsibility or whose role it is, the key points, which provides the how-to, and the reasons why we do this. In this video, I am going to focus more on the major process steps and the key points. So when the patient calls, that's our trigger. The patient calls, they say they'd like to schedule a new patient appointment. We're going to enter the patient name and date of birth to search for them. But first, we're also going to ask the patients for their insurance name and type. Check the insurance against our payer list. That's our in and out of network grid. We do want to make sure before we build an entire chart that we take their insurance. So if the insurance is out of network, we're going to inform the patient of the out-of-network financial responsibility. C, if the patient accepts financial responsibility, we're going to continue with scheduling the new patient appointment. D, if the patient is not in the system, we're going to enter the sex, social security number, and then click new patient. If the patient declines a social security number, we're going to enter all nines. There's an option there to select all nines. That lets anyone in the organization know that the patient has declined and does not want to give us their social security number. Okay, so we're not going to continue to ask for it. Now, if unknown, we would enter the 0001, and that lets anyone know that we still need to gather this or collect the social security number from the patient. F, if the patient is in the system, verify steps 2 and 5. Once complete, we're going to proceed to step 7. Number 2, we're going to accurately complete all patient demographics, general information fields, and preferred name if provided. And here, A, we're going to proceed with registration, making sure to capture all 10 registration points. Technically, it's 9 registration points here because number 10 has to do with the document table, which we don't work with when we're scheduling a new patient appointment. I am not going to read through all of these. There's a video that Michelle does, a live demo about all of our 10 registration points. So you can watch that after this one. B, ensure that all fields are answered to include the reason from the dropdown. C, invite patient to my chart. D, PCP or specialist on care team to be left as unknown until check-in. So we're not going to put in the primary care doctor or the specialist that patient's going to be seen with until they actually show up for their appointment. We do not want a patient linked to a provider that they've never seen. Number 3 is, enter correct appointment visit type. So in this case, it would be a new patient. And A, document appointment notes. So we're going to example is previous Dr. Doe, left leg pain, or referred from urgent care, follow-up medications. The key here now is no abbreviations. So we know that some of your offices use abbreviations for certain procedures and things that your office knows about. But what we're talking about here is when we spell out follow-up, we're not putting FU or FWUP. Or if it's new patient, we're putting NP. It could be nurse practitioner. The point is that most of us have different ideas or understandings of which abbreviations we're using, and you're not the only ones that see your appointment notes. So in order to keep it clear, for clarity reasons, please make sure that you're not using abbreviations, okay, and you're spelling everything out. B, new patient if not seen by a healthcare professional of the exact same specialty and subspecialty within the group in the last 3 years. So if the patient hasn't been seen in 3 years, they're going to be considered a new patient. C, emergency department patients are new if not previously seen in the practice. D, urgent care follow-ups are established or follow-up patients to primary care only. E, the transfer from EMA provider to EMA provider equals transfer of care. F, transfer from EMA provider to nurse practitioner / physician's assistant, or a nurse practitioner to physician's assistant to EMA provider is going to equal a new patient. And then G, transfer nurse practitioner to nurse practitioner would be considered a transfer of care. So for those primary care offices, when we're transferring patients from office to office, that's how you would choose the visit type. So whether it's going to be a new patient or if it's going to be a transfer of care. 4, we would now add our guarantor information. The patient may or may not be the guarantor. The guarantor is the person responsible for the payment of the services provided. 5, we're going to enter the correct insurance information and repeat process for secondary insurance. So this is where we would go into the Epic, select the insurance that the patient has. Please make sure that you're asking the patient over the phone what the claims address is on the back of the card. That way, excuse me, we're able to select the correct insurance and build it correctly from the start. Okay, once we've selected and built that, we're going to send that query. This is number 6, send the query and wait for the response received on both primary and secondary insurances. A, we're going to review and ensure the insurance is eligible. So read any eligibility and alerts or mismatches. Please take the time to review this. We're seeing a lot of mismatches. So whether it's a group number, that something has changed on there, or whether the name is incorrect, we want to make sure that we're getting a clean RTE. So that means no mismatches, no content error, no content connectivity error. Everything should be a clean RTE, okay? Once it's a clean RTE, we're going to select create coverage. So if eligible, create coverage. C, if the patient's insurance is ineligible, select ignore response. And call the patient to obtain new insurance information, enter and update the correct insurance. So you can also be on the phone. You may also be on the phone with the patient while doing this process. So you can just ask them right there and try to figure out what the issue is if the insurance is ineligible. Okay. Number 7, if unable to verify insurance electronically, we're going to call the insurance to verify. Yes, you have to call, and then complete the patient eligibility and benefits inquiry form. Okay. If you're unaware of what that form is, please contact me and I'd be happy to send you a new one. A, complete the patient eligibility and benefits inquiry form. So we have a paper version, that's that paper. And then we also have electronically using the covered benefits section. If you are not familiar with that as well, please contact me and I'd be happy to show you where that's at. B, we're going to scan the completed form into the documents field by selecting Launch ILE, then selecting Insurance Verification. Be sure to label the document as shown here. An example is Blue Cross eligibility in all caps with the month and then the year with the date. Okay. Number 8, link referral if applicable. So if you're in a specialty office and you're scheduling a referral patient, a new patient with a referral, we would highlight the appointment, right click and select link order or assign referral, choose appropriate order or referral, and then we're going to ensure both green check mark and the clipboard are visible from the appointment desk. Number 9, we're going to manage the pre-reg work queues. This is kind of your, daily duties type of thing. So we would want to complete any missing pre-registration items other than the MSPQ, which is completed at check-in. So pre-reg that you do daily, whether you're a couple days out, a day out, or you were ahead of the game doing a month out, make sure you're just keeping up with your pre-registration items. Okay. That's it for this video on new patient registration. Thank you.